and you will see. On this occasion, you will launch the National Accelerated Immunization Campaign, which is going to be across the country. We will also be looking for you to launch and flag off distribution of 2.1 billion worth of vaccine cold chain equipment that have been supported by Gavi and the World Bank. Finally, you will also send off these, my sisters and brothers from Cuba, to go to the 47 counties. With them here present, Your Excellency, are the teams that are receiving them on the other end and that will be working with them, represented by the CECs. At this point, would you kindly, the CECs present here, please be upstanding and wave to His Excellency the President. Thank you very much. Allow me, Your Excellency, to note how pleased we are under your leadership that Kenya has made significant progress in terms of health outcomes and also health initiatives. I wish to cite only three. One, on maternal mortality, we have seen a reduction of 488 per 1,000 live births from the year 2009 to 216 per 100,000 live births recorded in the year 2015. On infant mortality, this one has reduced from 52 per 1,000 live births recorded in the same period to 36.5 deaths per 1,000 live births. Through the Linda Mama program, over 1 million mothers have access to child delivery services at health facilities. Through the elimination of user fees at the primary health care, we have seen access to essential services go up. Building on these successes and the programs that you will launch here this afternoon, Your Excellency, it is clear that we will reverse the declining trend of the percentage of unvaccinated children. Indeed, I'm happy to report to you that the equipment we are launching here today is an important milestone in strengthening health systems across the country. The equipment, which include cold chain equipment for immunization services, also incubators for newborn children, and oxygen supply equipment that will contribute towards ensuring that every child is immunized and gets an opportunity to survive and thrive. This cold chain equipment will result in 90% of all health facilities having the capacity to store vaccines and therefore offer immunization services to Kenyans by the end of this year. This percentage is the intention of the ministry, working together with the governors and our partners, to get to 100% by the end of the coming year. This is significant since Kenya will then attain equitable and sustainable improvement in immunization coverage across the country, an achievement that will address fluctuations in vaccine coverage rates that the country has experienced in the past years. Your Excellency, again, we and the health teams in the counties represented here by the CECs and their governors are delighted about the Kenya-Cuba cooperation. We look forward to learning from you, our colleagues from Cuba. We look forward to you mentoring our colleagues in the counties. We especially look forward to learning from you on the provision of primary health care, which is going to be a major driver of universal health coverage. On availability of medication, Your Excellency, we are proud that KEMSA continues to be strengthened. And on institutional strengthening of KEMSA, but other institutions around the ministry, it's my pleasure to note and appreciate KEMSA for hosting us here today, that through the support of Global Fund and harnessing on domestic resources from the institution, KEMSA has commenced construction of a modern state-of-the-art storage facility right across this field, and that these will tremendously improve the supply chain management capacity across the country of medication. The facility will supplement these existing warehouse as well as the regional vaccine depots. When this is complete, Your Excellency, it will again be my humble request that will come and look at your diary and invite you to come and commission this milestone in the next 12 months. I also wish at this point, Your Excellency, to recognize the partners who have worked on this program and the interventions that you are launching here for us today. We have the World Bank representative, be upstanding and just await, please. World Health Organization, Dr. Rudy, I saw you. CANCOR representative. We have UNICEF, Deputy Head of Mission. We have Gavi representative. Thank you very much. I will now take a moment only, Your Excellency, to really appreciate my team led here by Dr. Rashid for making sure that all the moving parts on the Cuban bilateral and making sure that the doctors are here with us. They've learned a bit of Kiswahili in the 3 weeks they've been here. They've learned about our culture. They're excited and ready now to go to the entire country. Ladies and gentlemen, if we are standing, I will now request very humbly, as is my duty, His Excellency the President, to address us and launch for us the programs ahead of us. Thank you, sir.
Thank you very much. Please be seated. Thank you very much. Good afternoon, everybody. Let me begin by apologizing for coming a bit late. Governors present, ladies and gentlemen, let me begin by saying it is with great pleasure that I join you today as we launch this national immunization campaign to promote the health and well-being of the Kenyan children. Let me also say it is with great pleasure that we are also here today to welcome in a special way our medical specialists from Cuba who have been through and have received the necessary induction and will soon be deployed across our country to further our promise that every Kenyan has access to quality healthcare services. All this, ladies and gentlemen, is in line with our Big Four agenda, and my government is committed to achieving 100% universal health coverage for all households, indeed, as we saw for ourselves in Cuba. Through the Ministry of Health, investments are being injected into our health systems towards more affordable and available health service delivery. Our mothers today are now able to deliver their children safely and inexpensively under professional health care through the free maternity program. Let me also congratulate county governments who, despite the teething difficulties mentioned by Governor Kuti, are also expanding their public health infrastructure to improve access to quality health care for millions of Kenyans. Additionally, we have also positioned the National Hospital Insurance Fund to play a pivotal role in the transformation of health services in our country. Ladies and gentlemen, our doctor-to-patient ratio of 1 doctor to every 16,000 Kenyans continues, however, to be an obstacle towards achieving universal health care coverage. Local specialists are few and far between, yet their services are in high demand across the country. The bilateral agreement reached between Kenya and Cuba will therefore enhance health collaboration in specialized service provision and also help build up our local capacity, as was mentioned by Governor Kuti. The 100 Cuban doctors here, specializing in fields ranging from cardiology, neurosurgery, amongst other specialists, are now ready to move to the counties, and I'm delighted today to formally send you off to deliver the much-needed services that our people require. And I call upon all Kenyans to embrace and support them as they would their brothers and sisters. Ladies and gentlemen, it is also a priority of my government, which is the second part and reason why we are here today, to promote and to protect the health of our children. Indeed, the failure to immunize children will not only undermine the health and human dignity, but will also occasion national risks such as disease outbreaks. I am therefore pleased again today to be part of you as we launch the National Rapid Results Initiative on child immunization, which will increase the number of children that are immunized against killer diseases. We also today are flagging off essential materials, child health and immunization equipment, vehicles and motorbikes to all our counties to facilitate this vaccination target. I urge the Ministry of Health, the Ministry of Education, to work closely with all our county governments to put in place measures to ensure that all our children will be vaccinated by the time they join school. Beginning today, however, the Ministry of Health and all county governments should start a 100-day accelerated rapid results initiative to immunize all children who may have missed their vaccinations in the past. This campaign should be sustained and repeated if necessary until we achieve our target of full immunization coverage. I also take this opportunity to congratulate the Ministry of Health for mobilizing the necessary resources to construct the state-of-the-art KEMSA warehouse that we see here today. This initiative will greatly improve KEMSA's ability to store sufficient stocks of high quality but also affordable medication and equipment. Finally, ladies and gentlemen, as I close, I would like to acknowledge all our friends who are mentioned by the CS from the international community, Gavi, the World Health Organization, UNICEF, and the World Bank, who continue to work diligently to find solutions to our maternal and child health problems. We also recognize initiatives spearheaded by different partners and stakeholders aimed at ensuring that all Kenyans are able to access cost-effective, preventative health interventions. I want to say that all these partnerships make us proud and happy, and we thank you all for participating. Lastly, to my friends, we want you to feel very much at home here in Kenya. We thank you for coming out to join us. I look forward to meeting many of you as we do our rounds across the country. This is your home. These are your brothers and sisters. We thank you for your commitment. We thank you for your service. And we hope that you will enjoy your stay with us here in Kenya. And this will begin and form a foundation for a long-term partnership between our two great countries of Kenya and Cuba. So please, I close by saying, welcome, Karibuni Kenya, feel at home, and I look forward to participating with you and meeting you as you carry out your duties in various parts of the country. Thank you, and God bless you all. Thank you very much.
Well, it is done and dusted, and it is official now. The Cuban doctors have officially been sent off to the counties where they will be operating as a specialist. A huge number of them will be operating as a specialist in various hospitals across the country. President Uhuru Kenyatta there just ending his official speech as he officially commissions the Cuban doctors who were imported and jetted into the country about 3 weeks ago to begin work in the country amid a lot of controversy and a lot of disagreements with the official union for the Kenya Doctors, Pharmacists and Dentists Board. I want us to now take a short break. We still have a lot more lined up for you in the second hour of KTN News Desk. Don't go too far.